Okay, this video is top hospitals of US News and World Report. And what I'm trying to tell you is it's a joke. Okay, all the hospitals in the Western world, they have to go by what is called a standard of care. And that means they're all going to do the same thing. When the patient walks in the door for an internal medicine problem, they're most likely going to get a blood test, maybe an imaging test, and then they're going to prescribe a drug. That's what internal medicine subspecialties do. Now, there is one advantage to these big hospitals is that if they do high volume of a specialty surgery, like some place might specialize in, a complex, rare form of cardiac surgery, transplant surgery, or something like that, then they could be pretty good at that. So if that's your situation, which is rare, it could make sense to go to some specialty hospital. But there's a lot of other things that are the opposite of the truth. For example, they rank some of the Harvard hospitals as #1 in psychiatry. These are the same places that recommend amphetamines for children. So basically, at these places, at these big name hospitals, lots of the professors are sellouts to the big drug companies just to sell their drugs. That's how they get promoted. That's how they get their grant money for research. So they're actually a lot of the worst places. But don't get me wrong, it's basically, just BS with prestige. You go to psychiatry, they're going to drug the crap out of you. You go to rheumatology, they're going to give you these powerful medicines that are like chemotherapy. You go to neurology and they don't know anything about dementia. They just prescribe you a medicine that doesn't work for Alzheimer's. They don't even know the dementia theories. You could read their textbooks. I'll talk about that in a separate talk, but their textbooks are a joke. These big name medical centers, all their textbooks are drugs and surgery. Nonsense, okay? Like for heart disease, why do I say nonsense? Cleveland Clinic, the so-called Great Cardiac Center, they didn't even want to allow Dr. Esselstyn to teach his vegan diet, but his vegan diet is 1,000 times more powerful than cardiac stents or cardiac surgery for the standard coronary artery disease that the vast majority of Americans have, middle age and older. For diabetes, they teach you pills. They don't teach you a low-fat vegan diet of McDougall and Kempner and all that. So I just tell you that, recognize this stuff. It's just advertising. And unless you know nutrition, epidemiology, and toxicology, subjects that are not taught in conventional medical system, then you really don't know how to treat chronic disease. You don't understand it hardly at all. You go to any of these big name cancer centers, they're not going to know the metabolic theory of cancer. They're not going to teach you the metabolic theory of cancer, how to empower you to help yourself. They're going to talk to you about chemotherapy, radiation therapy, surgery, and all that kind of stuff. If you go there for prostate, I will bet you. Now, I haven't, seen their latest info, but I just know from experience. I will bet you these famous medical centers, they're not going to teach you about the Ornish diet and controlling your low-grade prostate cancer with diet and health habits, sleep, nutrition, and all that stuff, and exercise. I will just bet you, because I've never had a patient tell me that they were taught that. So anyways, I'm just letting you know how it all works.